I'm Maya. This is my student badge. I'm performing a respiratory exam today. Here's a pan of the room. Hi, my name is Maya Bowers. I'm going to be the nurse practitioner taking care of you today. How are you doing?
Good.
Good. So I am going to be doing a respiratory exam on you today. I just am going to be kind of looking at your chest and listening and doing a few tests on you today. Is that all right?
Mm-hmm.
Okay. First, I'm just going to have you kind of sit up straight and just do some normal breathing for me. I'm just kind of looking at your chest, how it expands, looking at your breaths and seeing them. I'm going to take a walk around and just look at the back as well. Okay, still doing those normal breaths for me. Perfect. Okay, so when inspecting, I am not seeing any signs of respiratory distress. Your breathing seems to be at a rate of about 16 to 18 breaths per minute with a regular rhythm and normal depth. I'm not seeing any accessory muscle use. Your breathing is unlabored. There's no intercostal retractions posteriorly and no subcostal, intercostal, supraclavicular, or sternal retractions anteriorly. Your skin is pink in color. I'm not seeing any signs of cyanosis noted. I am not audibly hearing any wheezing or stridor. I'm just going to take a peek of your trachea though. It looks midline. I'm not seeing any tracheal deviations there. And I'm seeing no chest wall deformities. Again, when observing, I'm seeing that your respiratory movement is symmetric throughout. I'm seeing no signs of asymmetry or impaired chest expansion during your inspiration and expiration. And then I was looking at your AP diameter to your lateral diameter, and I'm seeing that the AP diameter is less than the transverse diameter, which is consistent with normal chest shape. The next thing I want to do is I'm just going to place my hands kind of down on your chest down here, and I'm just going to feel you take a big breath in, and I'm just checking for symmetry there when you're breathing. So I'm just going to bend down here and place my hands right here, and I'm going to have you take a big breath. Perfect. Okay. I'm seeing everything symmetric there. I'm not seeing any signs of asymmetry. After that, I am just going to perform a test called tactile fremitus, and I'm just going to be placing the palms of my hand on various places on the front of your chest and the back of your chest. And then when you're doing that, I'm going to have you say the word 99, and then every time I move, I want you to try and say 99 again, and I'm feeling for vibrations. Okay, go ahead.
99. 99.
Down here.
99.
Around the sides.
99.
Okay, can I have you turn around, and I'm going to do that right on your back as well?
99. 99. 99. 99.
Under here.
99.
Okay, perfect. I felt the vibrations throughout. They're equal, and they are normal throughout both sides of your chest. Next, I'm just going to use my finger, and I'm going to percuss your chest, your front and back, and I'm going to be just listening through for resonance throughout your chest here. So I'm just going to place my finger on your chest and give it some taps, okay? Go under here. And on the side here. Okay, perfect. Can I have you spin around? We're going to do that same thing on your back here.
Let's do a Halloween pattern. Pumpkin, ghost. Pumpkin, ghost. Pumpkin, ghost. Pumpkin. What comes next? Yes! That's right. Good job.
That was fun pretending to trick or treat. Our magic Halloween box is back. Let's say the special rhyme and see if there's any more surprises.
Okay, perfect. You can spin back around. When percussing you, I am not seeing any abnormalities there. I'm hearing resonance equal throughout, so that is a normal finding there. Next, I'm just going to use my stethoscope here, and I'm just going to listen to you front and back, and I will just have you take some deep breaths every time you feel me move my stethoscope, okay? I'm going to start with the front here.
See, 3 ghosts. Let's count them. 1, 2, 3. 3 ghosts came out of the magic box. Can you pretend to fly like a ghost with me? Near and far. Flying near and far. Near and far and near and far. Near and far and near and far. Did you know that near and far are opposites? Near and far are opposites.
Perfect. Can I have you spin around? I'm going to listen to your back as well.
Are far away. Now the ghosts are near us. Now they're near us. And now they're far away again. Let's tell the ghosts a knock-knock joke. Knock-knock.
Who's there?
Boo.
Boo-hoo.
Don't cry. It's only a joke. That was a silly joke. Bye-bye, ghosts. Happy Halloween. Happy Halloween. I hope you have a great Halloween. Bye. For the next song, get out some scarves or dish towels or even clothes and we'll pretend they're leaves. The leaves are falling down. The leaves are falling down. Down, down to the
Perfect. You can spin back around. Your breath sounds are clear and equal throughout. I'm hearing no adventitious breath sounds, so that is great. Next, I am just going to perform a few tests. I'm going to use my stethoscope to listen, but I'm going to have you say some various words and sounds and letters and numbers, sorry. The first test I'm going to do is called a bronchoscopy. I'm gonna do front and back here, and I want you to say the word 99, and I'm just gonna listen throughout, okay? Okay.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, I'm gonna have you do that same thing on your back here.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay, you can spin back around. Okay, when listening and hearing you say the sounds, they are the test is normal. They're muffled and indistinct. The next test is called egophony. This one is you are going to say the letter E when I'm placing my stethoscope there. What I'm looking for is for it to sound like you're saying a long E and not a long A.
Okay.
So I'm going to do that as well. Okay.
E. Wait, am I supposed to just say E? Just E. Oh, okay. Yep. E. 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 E.
Okay. Go ahead and we'll listen to your back now.
E. 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 E.
Okay, let me spin back around. And for that, I am hearing all normal findings. It is not sounding like a long A when you're speaking. It's sounding like a long E. Okay, and the last test I'm going to perform here is called the whisper pectoriloquy. And for this one, you are going to whisper 1, 2, 3. And I'm just going to, again, listen with my stethoscope here. Okay.
Did you know that in and out are opposites? In and out are opposites. That was fun.
Which snake is longer?
Okay, spin around, do that same thing.
This snake is longer. And this snake is shorter. This snake is long. And this snake is short. Short and long are opposites.
Let's do our rhyme one more
Okay, great, you can spin back around. Alright, that test was normal as well. I was able to hear some of the muffled and distinct sounds up here, but once I got down to your lower lobes, I couldn't really hear them anymore. And that is a normal finding of that exam. So overall, your chest and your lungs and your respiratory system is normal, and that concludes our exam.
Thank you.